With the continuing impacts of COVID-19 on local communities, CVS Health is reminding the public that it is more important than ever to stay current with vaccinations and other routine healthcare needs. By getting a flu shot this fall, as demonstrated by Governor Baker, Lieutenant Governor Polito, and Secretary Sutters, and taking other proactive measures to improve general health and immunity, individuals can protect themselves against seasonal flu, contribute to the overall health of the community, and minimize the impact on healthcare resources. CVS Health is uniquely positioned to play an integral role in the delivery of care for patients across the Commonwealth. From the routine vaccinations such as the flu shot that are critical to maintaining health delivered at MinuteClinic and CVS Pharmacy every day, to the expanded pharmacy programs and retail-based clinical services offered at our stores, we're here to help people on their path to health. We know people have choices about where to get a flu shot. CVS Pharmacy and MinuteClinic are good options because we are conveniently located across the state and we have expanded evening and weekend hours. We also know that it's especially important to protect at-risk populations from severe illness during this time, including infants, school-aged children, adults over 65, and essential workers. At the same time we're helping combat the flu, we're also doing everything we can to expand resources for our community during the COVID-19 pandemic, including offering drive-through testing across the state. In fact, tomorrow, Friday, we're adding another 12 locations, including this very store, which will bring our total of operational sites in Massachusetts to 51. Governor, thank you and your team for calling attention to the importance of and the ease of getting a flu shot today. And thank you for your actions you are taking to ensure our communities and schools are staying as healthy as possible. Thank you.
Thank you, Doctor, and thank you for your hospitality. And I want to thank the team for giving me a shot that didn't hurt. Although I did have to get sort of undressed for it. I want to thank you for everything that CVS has been doing to help people deal with not just flu vaccines, but so many other issues during this particularly difficult period here in the Commonwealth and around the country. Lieutenant Governor and I both, and along with Secretary Sutters, both had a chance to talk with the pharmacy team about this particular location and how they're doing administering the flu vaccine. And we also all got flu shots, and so far anyway, so good. In a few minutes we'll talk more about our efforts with regard to promoting the flu shot this fall, which is especially important in the context of the pandemic. I do want to give a daily update on the COVID-19 hospitalization and test results. Yesterday, DPH reported over 16,000 individuals tested by molecular tests. That brings the total number of individuals tested to almost 2 million. We continue to be a national leader by virtue of any measure with respect to testing. And we're obviously grateful to CVS for everything that they've done to help people get access to testing here in the Commonwealth. That includes, as Dr. Fairchild mentioned, several new sites that will be launched around the Commonwealth starting this Friday. Statewide, the positive test rate on a rolling 7-day average continues to be 0.8%. There are 352 cases hospitalized and 56 that are currently in the ICUs. Yesterday, the Department of Public Health also updated its COVID-19 data map. As you know, this map designates communities with a risk level of high risk, moderate risk, or low risk, red, yellow, or green, based on the number of cases by population, and communities that have fewer than 5 cases are white. They don't have a designation. Compared to the last 2-week period, 93% of the communities in yesterday's report saw either an improvement or no change in their average daily case numbers. We applaud the efforts of the residents and the local officials in those communities in their efforts to stop the spread and stay healthy. Methuen moved from red back down, in fact, all the way to the lowest risk category, and a few communities, Nantucket, Plainville, Saugus, Tyngsboro, Worcester, and Rentham, moved into the high-risk category. Obviously, that means our COVID-19 enforcement and intervention team will be talking to them about what the causes of that increase might be. The first thing I would say about this, and the most important, is this data is a dashboard, and as numbers move week over week, the first thing people need to do is work with our team and with others in their own community to figure out why. Because that, in some respects, is the most important element in making sure that people are doing the things they need to do to deal with whatever may have caused their increase. That could include gatherings, it could include a congregate care facility, it could include a bunch of other things, but one of the things we believe is particularly important about this community-by-community data is the opportunity it gives people to continuously review with their local boards of health and with our Department of Public Health and with the folks on the intervention and enforcement team what exactly it is that's driving cases up in a particular community or driving them down. We want people, obviously, to continue to do the things we've talked about. They need to stay vigilant. If they go to a gathering of any kind, they need to socially distance, they need to wear a mask. Obviously, if people aren't doing that, we would urge people not to go to those kinds of gatherings. You should wear a mask whenever you leave the house and whenever you can't social distance, and obviously visit mass.gov/stop-COVID-19 for more resources. The vast majority of Massachusetts towns continue to show very low levels of transmission and very few cases. That's terrific progress here in the Commonwealth, but the virus obviously is still with us. One of the things we've started to do is a weekly update on what's going on with colleges and universities here in Massachusetts. As many people know, since August, colleges have begun regular implementation of their own COVID-19 testing programs for students, faculty, and staff. The results from those reports have been included in the daily testing and positive case numbers that are published by the Department of Public Health, and the test results from colleges will continue to be included in the daily numbers. Additionally, we'll now publish a weekly report that includes aggregate test results from participating colleges and universities. Yesterday, this report included around 60 colleges that are currently reporting results to DPH, and obviously will add results from other schools on a rolling basis if and when they begin their own testing protocols. Yesterday's initial report indicated that about 500,000 tests had been conducted as a part of this testing at higher ed institutions since August 15th, and about 500 positive test cases resulted from those tests. That's a positive test rate that's obviously well below the statewide average, and it shows that colleges and universities and students are doing their part to make sure that they open safely. Our administration's laid out comprehensive health and safety standards for all colleges and universities as they welcome students back this fall, which includes protocols around hygiene, sanitization, infection control, testing, isolation, quarantining, and more. And we talk to them on a pretty regular basis, and we're glad that so many schools are working hard to do the things that need to be done to implement these protocols, and that probably has a lot to do with why we've seen such low rates of positive testing so far. Now, with respect to the flu, every fall public health officials urge people to get the flu vaccine, and every year we're grateful for the partnership of healthcare providers in helping us administer the vaccine for people across Massachusetts. That includes hospitals, community health centers, and pharmacies like CVS. And this year, that mission is more important than ever. As we continue to fight COVID-19, it's critical that we do everything we can to minimize the impact of the flu and other respiratory illnesses. This will keep people healthy and help maintain capacity in hospitals and other healthcare facilities in case there is another surge associated with COVID-19. Now, back in March, April, and May, we all talked a lot about the amazing work that was being done by the folks who are part of our healthcare community here in the Commonwealth of Mass. And time again, people would speak to the incredible performance, the dedication, the excellence and the commitment that our healthcare workers were making to their fellow residents here in the Commonwealth of Mass. About a month ago, many of those same healthcare workers started talking to folks on our team about what it would mean to have the flu land at exactly the same time, a second surge for COVID-19. The point they made to us at that time was from a diagnostic point of view, from a care delivery point of view, from a capacity point of view, having the flu and COVID-19 surge in the Commonwealth at exactly the same time would be an incredibly difficult situation for them to manage their way through. And they urged us to step up our game, which is already pretty good relative to most of the states around the country, on flu vaccines. Now, I know some people are troubled by the fact that given the authority we have under state law, we mandated the kids and college students get a vaccination this year. But I have to come back to the message that came from a community that really put themselves on the line for the people here in Massachusetts at the end of last winter and through the spring, which was our healthcare community here. We said everything we can do to ensure that people are vaccinated for the flu makes their ability to do what they need to do for people here in Massachusetts through the flu season and the potential of a second surge can be done as well as it possibly can be. Now, we have an 81% positive vaccination rate for elementary school kids, right?
Yep.
We can do better, and we should. And especially with the return of so many kids to college, it's critically important that they get tested, they get vaccinated as well. And I would just say to all of those folks in Massachusetts who admire, respect, and appreciate the heroic work that was done by so many people in our healthcare community last spring, that for them and for yourselves, you should go out and get a flu vaccine this year so that you and they can feel confident that as they deal with respiratory issues this fall and the potential of a second surge, more and more people in Massachusetts will have protected themselves from having the flu pile on top of a potential second surge associated with COVID. It's also important, as schools open back up, that we do all we can to limit transmission among kids. That's why last month we made this announcement before school started so that kids and families could start planning how to handle this issue in advance. Well, the vast majority of the families in Massachusetts do a great job of getting a flu shot. Increasing the number of kids who get that vaccine can obviously help kids stay in school during the course of this pandemic. Helping kids get back to the classroom and keeping them there is one of the most important things that we, the adults, can do at this point in the ongoing battle against COVID. Many of the things we've been doing for months to stop the spread are exactly the same kinds of things that prevent the spread of respiratory diseases. I mentioned last week at a press conference that one of the things we'd heard from many folks in the healthcare world is the fact that people were wearing masks, that people were engaging in social distancing, that they were washing their hands, they were practicing good hygiene, had actually had a noticeably positive impact on the amount of traffic they'd seen in traditional respiratory illnesses, strep throat, earaches, infections, respiratory illness, and all the rest. And that's why it's more important than ever as the weather gets cold and we all start to go back inside more, that we remain vigilant and continue to do the things that we know can keep us safe. People here in the Commonwealth have done a great job in listening to and heeding the advice of their public health, neighbors, and medical experts. And in this particular case, it's very important to them, and it should be very important to you, that we do all we can to extend and expand our participation in this season's flu vaccination program. And with that, I'll turn it over to Secretary Sudders.
Governor Baker, Lieutenant Governor, Dr. Fairchild, and to all the folks at CVS, thank you for having us this morning. So first and foremost, it is easy to get a flu shot, and we are here to remind everyone that it is a very good thing to do this year to get a flu shot. And CVS and others make it very, very easy. And I want to thank the pharmacy staff and the pharmacy techs. Every year, thousands of people of all ages are affected by the flu, and it results in many hospitalizations and some deaths. During the 2019-2020 flu season, there were over 40,000 positive cases of influenza reported to our State Department of Public Health, 55,000 hospital emergency department visits, and about 6,600 deaths. As I said, so we strongly recommend that everyone over the age of 6 months gets an annual flu vaccine. Vaccine saves lives, and this is more important than ever as we head into a flu season that overlaps with a potential COVID-19 resurgence and the ongoing pandemic. As the governor said, many flu symptoms are very similar to those of COVID-19, and preventing the flu will not only save lives, but it is good public health as it preserves critical hospital medical resources to deal with the COVID pandemic. I'm pleased to say that Massachusetts has the highest rate of pediatric flu immunization in the country at 81%, but to be certain, we want all children in the Commonwealth are protected. We have required that all students attending school get a flu shot. Massachusetts has taken a lead on requiring flu shots for preschool, K-12, and college. Several states require flu immunization for child care or preschool entry, but we're the first state in the country where it is required for K-12 and colleges. As students return to in-person learning, whether that is now or in the future, for others, this vaccine requirement provides an additional and necessary layer of protection and safety for teachers, students, staff, and families. Of course, children who are homeschooled are exempt from the requirement, as are those who are provided with medical or religious exemptions. However, K-12 students in districts and schools learning on a remote model are not exempt. College students, similarly, who will have access to campus for activities are also not exempt from the requirement. The Massachusetts chapter of the American Academy of Pediatrics and the Massachusetts Medical Society have endorsed the Commonwealth flu vaccine requirement for schools as a measure to maintain optimal health for all families during the COVID-19 pandemic. We've worked to ensure that there's plenty of vaccine in Massachusetts this season. Over the past few years, the Department of Public Health has purchased approximately 900,000 doses annually. This year, we will receive 1.156 doses, which is about a 1.1, did I say thousand? I'm sorry. 1.156 million doses, a 28% increase. So let me say that again, my apologies. Normally, we receive about 900,000 doses annually. This year, we will receive 1.156 million doses, which is a 28% increase. To emphasize our message, we've developed a new public awareness campaign about the importance of flu immunization that you will be seeing rolled out next week. We will have messages airing statewide in Spanish and English across a variety of platforms, social media, digital, and on TV. Our goal, just as it is today, is to remind you to protect yourself and your family from illness this season by getting a flu shot today. And I'm pleased to say that CVS has been a very good partner for immunizations across the Commonwealth of Massachusetts and in response to the pandemic. I also want to provide an update on our COVID enforcement and intervention team activities. Since launching a few weeks ago, this team has focused on a strong collaborative approach with communities with the highest incidence rates of COVID-19. Initially, we focused on Chelsea, Everett, Lawrence, and Lynn, and Revere, and then Framingham. I'm grateful to the municipal leadership, their police chiefs, as well as their public health departments, who are supporting these stepped-up efforts in the pockets of the Commonwealth where we are seeing higher levels of COVID risk or persistent trends. So far, the team has helped enhance enforcement activities around gathering sizes, restaurants that turn into bars at night, and social gatherings in people's private homes, sometimes birthday parties and other family gatherings where people let their guard down. It's critical that we remain vigilant, keep our gatherings small, and masks up. These are the best ways to not only stop the spread and enable a path toward continued reopening, but it's also the best way to protect our family, friends, neighbors, and community. Additionally, we have launched a public messaging campaign in these communities. It includes an expanding advertising campaign, field teams that are on the ground that have been active for the past 2 weeks, and much more to help raise awareness on the ways people can protect their loved ones as well as themselves. I want to echo a point the governor mentioned. In yesterday's community-level report, 93% of our cities and towns saw either improvement or no change in their average daily case numbers. While this is a positive trend, we all must remain vigilant. Wear masks, get tested if you feel sick, and limit the size of gatherings. Chelsea, Everett, and Lawrence, for instance, saw numbers come down somewhat. While they still are persistently high, we see progress. An additional point I'd like to add is that if you feel sick, not only get tested, but stay home from work or school. You owe it to your family, loved ones, and your community. There are state resources available to help families in challenging circumstances. We're grateful to community leaders who are stepping up to help their neighborhoods. Thank you. Governor?
Questions on this?
Governor, schools have seen a little bit of a rocky start in some areas. We were in Lowell yesterday. They had to shift to all remote because there were a lack of air purifiers that they had not come in. And in Attleboro, a student who had tested positive for COVID was actually sent to school, and now dozens of students are now on quarantine. I wonder if you can sort of weigh in on both of those issues, and also, do you think in the latter case that that student should be expelled?
Well, first of all, I think everybody knew that heading into this year that this year would be different than other years because so much of the terrain on which school opening takes place has shifted. And we've worked pretty collaboratively with our colleagues at the school district level to provide them with resources, financial and otherwise, a ton of guidance based on work that was done by the public health group and pediatric group that supported DESE as they developed their protocols, and a lot of ongoing dialogue that's been happening almost on a daily basis over the course of the past several months. And I would expect that there would be some moments at the beginning of the year that would be rocky ones. I just have to emphasize what Secretary Sutter said about if you're sick or if your kid's sick, you or they should stay home. I mean, the good news is we haven't had many incidents of that kind of thing with respect to schools, and it's critically important that we don't, because there are real consequences associated with that.
Should there be disciplinary action against that student?
That's up to the local community to decide. That's their call. But as I said, I think the most important thing people need to understand about this is, in a situation where somebody knows somebody is dealing with respiratory issues generally, or COVID in particular, of course they should stay home.
Were you surprised to hear that?
Yes.
Governor, any thoughts about how to make people more accountable for these bad decisions that we're seeing being made and turning into schools getting, turned back to remote and stuff like that? In general, just, trying to make people more accountable for.
Well, one of the reasons we developed our guidelines and our protocols and our map with respect to testing in the first place was to give communities a clearer sense about where they stood. And I think it's important to remember that the vast majority of communities in Massachusetts are either in the no category, which means they have less than 5 cases, and in many cases have had less than 5 cases forever, dating back to August, or playing with less than 5 cases on a per 100,000 basis if they're green. And I think that's a tribute to the fact that, you know, the vast majority of people in Massachusetts are doing the right things. And as the Secretary said, in communities that had been persistently red for a while, they are starting to make progress. All of those opened on a remote basis. Many of them opened on a remote basis with teachers in the classroom, in addition to that. So there would be some normalcy associated with the opening for both the teachers and the kids. I think the rulemaking associated with how districts choose to handle this is very much up to them. But clearly it's important to send messages that are direct and understandable, that it simply makes no sense and puts others at risk to send children who are known to either have respiratory symptoms to begin with or COVID to school. Doesn't make any sense at all.
Governor, 2 questions. The first, the number of high-risk communities has essentially more than doubled in the past 2 weeks. I know last week we didn't want to, it wasn't a trend last week. Now it's been a couple of weeks. What's going on? Why does it seem like this is getting worse?
I don't think you can draw a conclusion that this is getting worse based on that data. One of the things we've said, and it's advice that we've given to school districts and to local officials as well, is you got to track 3 weeks worth of data before you have a quote-unquote trend, which is why we talk about certain communities as being persistently high risk, and others sort of pop in and pop out. And part of the reason they pop in and pop out has to do with things like a congregate care facility or a particular gathering or an incident that took place that involves a church or something like that. It's critically important that those be recognized, understood, and dealt with on a timely basis, which is part of the reason for continuing to update this data every week and part of the reason for why we continue to provide significant testing resources in communities that either have been high-risk communities or in many cases are medium-risk communities, because we don't want them to become high-risk communities. But again, I think the point I'd make there is there's a lot of effort being made on our part to work with, coordinate with, and implement policies to deal with communities that become high risk so that they can get better. And we have seen many communities come out of that category. At the same time, we've seen others move in. And I fully expect that trend will continue. The thing we need to really focus on are the folks who are persistently high risk. And that has been, for all intents and purposes, where the vast majority of our effort's been to date.
Okay, and yeah, I just had a follow-up to that. Some leaders in those communities say that it's not fair to use census data that's a decade old for, when it's 8 cases per 100,000 residents. They're saying it's not an accurate depiction, and also in some of communities like Nantucket or Chatham, where they have big populations coming in and out. Is it fair to classify these as high risk or red zone categories when it's census data that's a decade old?
The census data, for the most part, does get updated on a fairly regular basis. You don't do the census once every 10 years, but people continue to make estimates about what they think the population of a community is based on other means, which they have plenty of information to do that with. I think part of the reason why our guidance has said this is going to be weekly, it's going to measure based on what most people have decided are some of the key measures with respect to how you measure low, moderate, and high risk. And it's going to be the sort of thing we're going to put out there, and we're going to expect people to work with their local boards of health and with our Board of Health, our public health department, to determine what in fact created this issue and what needs to be done to deal with it. And I go back to the fact that the vast majority of communities in Massachusetts, since we started doing this, have either been green or white, which means for all intents and purposes, they have very low COVID transmission, And we have had communities, Methuen's a good example, that went from red to green in 1 week. Now, that's because the incident was a particular incident. It was a single incident that moved their numbers over that period of time. The thing we need to pay attention to, and where our primary focus is on people in communities, local officials, boards of public health, folks in those communities that are persistently in red, that are persistently high risk, and what can we do to help them work their way out of that situation. People are going to move, there's no question. But again, 90% of the communities in Massachusetts either stayed the same or went down this last week.
Governor, presumably there'll be a vaccine for COVID-19 at some point in time. And when do you see places like CVS as part of the distribution network? And what's being done currently to sort of prepare and plan for that inevitability, I guess, if at all?
So there's a federal working group that is working with states on planning with respect to vaccine distribution. Not flu vaccine, COVID vaccine distribution, and we are, deeply involved in that activity. And I would just go back to what Secretary Sutter said. We get about 900,000 flu vaccines a year, which get distributed through a variety of tried and true mechanisms that are already in place. It is my assumption that whatever were to happen with a COVID vaccine would probably run through a fairly traditional distribution model because it's already there. The one thing I do think might be different about it would be a focus on particular high-risk individuals to begin with, which would mean in Massachusetts, healthcare workers, long-term care workers, people in communities of color that have been particularly hard hit by the virus. I mean, that's kind of the way we would be thinking about where you'd want your priorities to be coming out of the gate. But the distribution, I don't know why we would work on completely turning upside down a distribution system that works pretty well.
Governor, the president has
disagreements that are taking place in Washington, for example, the White House and the CDC over vaccination. I guess I'm curious to know what kind of problems that creates for the state of Massachusetts in trying to deliver a message about what we should do and how we should handle this virus going forward.
So I think one of the most important elements that's developed during the debate and discussion about the timing and the efficacy of a vaccine is the fact that all of the companies that are working on developing a COVID vaccine have all basically signed an agreement jointly that says we're not going to do this unless the clinical trials and the results of those trials show that a vaccine or several vaccines are in fact safe and effective. And those companies are more than sending a message casually. I mean, that's a big, I've never seen that happen before. That's a really big statement about the fact that they get the fact that this needs to be something that is properly processed, properly reviewed, properly approved, and that they're not going anywhere until that stuff happens.
Right, but the president himself is openly contradicting Dr. Redfield and saying, his guidance on masks and his timeline on the vaccine, I mean, they're at odds. Does that make your job harder in terms of messaging to the people of Massachusetts?
One of the reasons we spend as much time as we do messaging at events like this and others to the people of the Commonwealth is to try to do the best job we can expressing to them what we think is important, what we think matters, and what we think, what we believe we should pay attention to and how we should do this. And we happen to be blessed with an incredibly robust collection of research institutions, infectious disease specialists, epidemiologists. I mean, the amount of talent that we have in this community that the secretary or the lieutenant governor or I or anybody who's playing in the public square can reach out to get advice and guidance is extraordinary, and we do it on a pretty regular basis. I've said before that I think one of the reasons why people in Massachusetts, for the most part, have been really solid citizens around face coverings and distancing and hand washing and playing by the rules and all the rest is because the message that's been coming from our administration, the message that's been coming from local officials, the message that's been coming from folks in the public health and the medical community has been remarkably consistent. It's changed as we've learned, right, along the way about how this virus works and how it affects people. But generally speaking, the message coming from most of the players here who have the microphone has been remarkably consistent. And when the feds are moving in different directions, all we can really do here is try and make sure that we continue to message what we believe to be the best and most appropriate ways to move forward on this. And again, on the vaccine, I've never seen, I've been in and around the healthcare world now for a long time, and I've never seen a group of companies come together and basically say, nobody's going anywhere until we're absolutely sure we're going to get this right.
Yeah,
And I take a lot of faith in that.
That message gets lost, though, to tell you the truth, when there's this dispute between the White House and the CDC over, you're right, that is like impressive, but I don't think anybody pays attention. They pay attention to what comes out of the White House and the CDC.
There's no vaccine manufacture, production, or distribution unless those companies sign up to do it.
How do you get people to be vaccinated? I know for the first time we're doing the flu requirement to get into the schools and stuff. Do you foresee something like that just to try to get full participation?
We'll have more to say about that as the guidance comes from the CDC and from others with respect to how to do this. But it's clearly something that we're paying attention to and we'll be ready for.
Because people sometimes they just don't want to do it. Like whether it's the flu vaccination or the COVID vaccination, they just don't want to be vaccinated.
Well, we have religious exemptions in Massachusetts. We have medical exemptions, and people use them. But I certainly believe that the process around, part of the reason why I think the companies were so aggressive about speaking out about how they were going to move forward or not with respect to a vaccine associated with COVID is because they get how important it's going to be for that to be viewed as not just effective but safe. And I fully expect that for some people that may not be enough.
Governor,
okay, they can wear a mask, they can socially distance, they can do all those things. But for the people who are in really close contact with people who are dealing with COVID, or for people who are in communities that have been absolutely battered by this, I think it's critically important that we make sure they have an opportunity to access a vaccine that's deemed to be safe and effective and has been sort of signed off on by both the companies and by the CDC.
One last question on schools. As you know, there are a lot of communities with extremely low rates of COVID positivity that are starting the school remotely. High school students in their communities have no plans in the foreseeable future to go to school in person. And Tom Scott of the Superintendent's Association says that your philosophy of small government and local control is partly to blame for that. That it worked really well in other education decision making, but in this case, getting schools back, to functioning during the pandemic really required an education czar with your type of with your popularity and your weight to really wrestle all these groups, bring them together to go back to school. I'm wondering what you think of that.
Well, it's funny. In this job, and I've been in local government, so has Lieutenant Governor Polito. It's funny, the decisions that people want to make, wherever they fit in the distribution chain on this. We have always in Massachusetts believed that the state's role is funding, guidance, and accountability, but the how question belongs to the locals. And because we have 351 cities and towns, many of which are different, and to get back to the conversation we just had about high risk, moderate risk, and low risk communities, all of Massachusetts is not the same. And for us, $1 billion in federal and state resources for cities and towns to deal with COVID and to move forward on schools. a ton of guidance developed in conjunction with our public health experts and our pediatric community to make sure that we were putting the right sort of information out for cities and towns and school districts to use with respect to making decisions about this. Our message all along has been, we want to see kids back in school. The Lieutenant Governor and I have visited programs over the course of the summer that never stopped educating kids, especially special needs kids who desperately need that face-to-face and day-to-day contact to both make progress and in many cases not regress. And I think for the most part, between the guidance and the resources and the ongoing dialogue and the constant willingness to change and adjust based on what we were hearing from our colleagues in local government, we put a platform and a plan in place that would make it possible for people to open. But at the end of the day, that decision here in Massachusetts under state law gets made by the locals. If I could make it, I would, okay? But I do not have the authority to do that, and I wish I did.
Any thoughts
Governor,
about
just
helping-
one quick-
any thoughts about
Governor-
helping parents who can't go back to work full-time because of the kids?
Well, one of the reasons we created that new set of regulatory standards was for learning pods was specifically to deal with this. And I'm incredibly excited about the way a number of communities, YMCAs, Boys and Girls Clubs, in some cases child care providers, in other cases it's even local education collaboratives are taking advantage of that learning pod model, and they're, in a bunch of instances, actually doing it in the schools. And I think in some ways, both from a project learning opportunity or a STEM learning opportunity or educational enrichment, there are tremendous possibilities associated with that. I'm really glad we spent a bunch of time talking to people about creating that kind of opportunity, and I expect you're going to see those things pop up and bloom all over Massachusetts, and I think they may end up becoming a very important and significant part, not just of how we educate through the pandemic, but how we educate, period, as we go forward, and that could end up being a really good thing.
Governor, quick question on long-term care facilities. We had a viewer email us. They want to know when they'll be able to resume indoor activities, like games, inside long-term care facilities. They say the seniors have suffered enough isolation.
I see my dad maybe 3 times, all outside, in the course of the past 5 months. I have a very personal appreciation for the difficulty associated with keeping seniors safe and the challenges associated with that. I do think outdoor visitation has been a big win based on the feedback that we've gotten. And we've been talking to folks in the industry and folks in the public health world about how to create further opportunities for engagement, recognizing you can't stay outdoors given the changing nature of the weather. And I fully expect we'll have more to say about that in about a week.
Governor,
Thanks,
the
everyone.
compressor station in Weymouth says it wants to go online in 2 weeks. They just had a significant accident, maybe the wrong term. But
That is the wrong term, actually. Yeah.
Incident, yeah, probably the wrong term, an incident. People are still concerned down there. Any thoughts on them wanting to open up in 2 weeks?
It's the first I've heard of it. I mean, generally speaking, most of the decisions associated with that are made by the folks at DEP following federal guidelines and operating in conjunction with FERC. But that's the first I've heard of that. I didn't know that.
Okay, but any thoughts on it now that you've heard about it?
Well, I'd like to talk to the people who actually know a lot more about it than me before I comment on that.
Thank you.
Okay, thanks
Thanks,
everybody. Get a flu shot before you leave.
Thanks again. Thanks for setting up the